Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Welcome into the program, Mon Health Talk. Hope your weekend was a nice weekend. Hope your day's off to a nice start. Coming up on this morning's program, we're going to discuss Prostate Cancer Awareness Month, and joining us on the show is urologist and master surgeon, Dr. Shakuri-Rad, friend of the show. And I guess you're a veteran guest on the program, Dr. Shakuri-Rad. Thanks for joining us.
For having me.
We'll always like to visit with our guest for a few moments. Of course, we've had you on the program a couple of times, but just remind people of your background.
Sure. So I graduated high school along with my wife in Parkersburg, West Virginia. My wife and I came to Morgantown for our undergraduate training, and she actually did some of her graduate level training here as well. And I went to Lewisburg, West Virginia for my medical school and moved out to Michigan for my urological surgical training as well as robotic surgical training.
What do you do in your free time? I don't know if we've asked you that before. What do you do when you do get some time off from work to just kind of take it easy?
That's a great question. And so, I have two boys. They're 7 and 8, and they take up a lot of our time. And then I enjoy going outside, playing ball with them, taking them to their respective sport activities. And aside from that, I do enjoy sports myself. I used to play basketball and soccer when I was growing up, and I try to dabble in those sports as time allows.
See, you can still beat the Suns in basketball right now, but the time's coming,
I believe so, and I'm looking forward to that time.
Well, September is Prostate Cancer Awareness Month. How common is prostate cancer?
Sure. So prostate cancer is the second most common cancer in men, and according to the American Cancer Society, there are going to be about 250,000 new prostate cancer cases in the U.S., and unfortunately about 34,000 men will die from prostate cancer. This is an unfortunate increase in number. Last year, I believe I was on the show and I quoted a number around 190,000 new cases, and that has gone up significantly. And in West Virginia alone, we are expecting to have about around 12,500 new cases in 2021, with an estimated number of deaths of about 4,500. And so these numbers, in comparison, we are facing a current healthcare crisis with COVID. And for instance, COVID numbers as of last check were about 3,300, 3,400 deaths from COVID. So that kind of puts it in perspective. And we often forget during such healthcare crises that there are patients with other medical problems that we still have to attend to.
So when it comes to prostate cancer, is it like other ailments, other cancers, the key is early detection?
Absolutely. And so the earlier we are able to find a disease, a problem, the earlier we can intervene, and the long-term outcomes change dramatically. And so it's very important for men and for women who have men in their lives to kind of encourage them to go get tested. A lot of us guys tend to be stubborn. We don't want to go seek health care and go get examined. And so a simple physical examination and some blood work may be the key.
And that would, I would assume, be part of a yearly physical, a yearly checkup if you're going on a regular basis?
Correct. A lot of the family physicians will discuss yearly screening exams with patients. There's always joint decision-making regarding all different diseases, including prostate cancer screening. And if a patient qualifies, then the screening can proceed. And if there is a concern, then the patient may be referred to a urologist such as myself for further evaluation.
So what could a patient who comes to see you expect as far as a treatment plan?
So, we often talk about first risk factors and, chances of getting prostate cancer. And like many other cancers, a family history may increase a patient's risk. Age, specifically, men who are older than 50 tend to be at higher risk for prostate cancer. African American race is a significant risk factor. And there are some other associations, but several of them not as concrete risk factor, and we review all of those. Now, if a patient has received the screening, such as the physical exam and the blood work, their blood work may have been abnormal or their physical exam may have been abnormal, so we confirm that first. And depending on the results, we may discuss some additional workup for them.
Talking to Dr. Shakuri-Rad, September is Prostate Cancer Awareness Month. So how do you go about treating a patient? You've confirmed that there is prostate cancer, so how do you go about treating them? Is this where the robotic surgery comes into play?
Absolutely. So robotic surgery or prostate surgery has been shown to provide patients with the longest survival benefit compared to other treatment modalities, including radiation. And it all depends on a patient's age, their other comorbidities, their specific cancer that's diagnosed, because prostate cancer is a spectrum of different cancers. And put all those things put together allow us to really provide patients with the best counseling. Sometimes a robotic prostate surgery or prostatectomy is the best option, and that may provide patients with the most benefit. Other times we may have to choose some other modalities such as radiation or hormone therapy. And again, it's very important to see a specialist that's well-versed in all of these treatment modalities, or at least has someone in their practice that can assist the patient with all these.
Will prostate cancer present symptoms?
Prostate cancer is a silent cancer in most instances, especially when it's localized. Some signs could be things such as blood in the urine. Blood in the man's ejaculate can be a red flag. Erectile dysfunction at a younger age can often be a preceding event. Trouble urinating, which most men attribute to an enlarged prostate, could also be a sign of prostate cancer. So if there are any of those things, it's important to discuss them with your physician and seek appropriate care afterwards.
Talking to Dr. Shakuri-Rad this morning, Mon Health Urology, and we will continue the conversation right after this break on the Voice of Morgantown, WAJR.
Does your family need more room to run? The kids, the pets, they all need more space this summer. Whether you're looking for some extra space in a new house, or you're just starting out and ready to buy your first home, or you're going to add onto your existing home, make sure you talk to the professionals at First Green Mortgage.
First Green Mortgage.
Their loan officers have worked locally for years. They will take you through the process of applying for a mortgage loan step by step from the pre-qualification until you settle into your new home. Your loan officer will be with you from start to finish. They even specialize in owner-builder loans where you can serve as your own contractor. And First Green always holds on to your mortgage. You don't have to worry about your loan being sold and resold. If you have an issue, just give them a call or stop in. Call a First Green loan officer today at 304-598-0060. Visit their office at Suncrest Town Center in Morgantown or apply anytime online at firstfederalofgreen.com.
First Green Mortgage.
First Green Mortgage Corporation is a wholly owned subsidiary of First Federal Savings and Loan Association of Greene County. Equal housing lender. NMLS number 458729.
Friday night, University against Fairmont Senior.
To throw. Deep down the middle, a man is there. It's Jackson. It's caught, and it is a touchdown for University. Elijah Jackson reels it in.
Coverage at 7:06, then game night until midnight. We'll scream Morgantown at Woodrow Wilson.
There's the reverse, and Lawrence has some room to run. Running away from defenders down the far side, keeps his feet inside the 10, the 5, dives for the pylon. Touchdown, Mohegan.
Morgantown at Woodrow Wilson. Clay Battelle at Tigers Valley. Streamed at WHAR.com.
Friday nights in the fall are reserved for high school football, and the 20-year tradition continues on Metro News. It's Summit Community Bank High School Game Night with Fred Persinger and Dave Jecklin, celebrating 20 years of bringing you up-to-the-minute scores, conference standings, player and coach interviews, and more. Tune in all season long to follow your favorite school. Friday nights from 9:30 to midnight. Summit Community Bank High School Game Night on this Metro News station.
Kevin Harlan here from Monday Night Football on Westwood One. Join me and Tony Baselli from Lambeau Field in Green Bay. It's Aaron Rodgers and the Packers playing host to Jared Goff and the Detroit Lions. Both teams are looking to bounce back from losses in Week 1 and pick up their first division win of the year. Don't miss any of the action on Monday Night Football.
Coverage at 7:30 following the Sports Line Monday here on WAJR.
At Hannah's Organic Honey, business may be sweet, but they need an e-commerce queen bee to lead the hive.
Okay, these jars are going to Jakarta. Oh, wait a minute. Does that say Jackson?
Indeed can help them hire great people fast.
I need Indeed.
Indeed you do. Schedule virtual interviews and talk to candidates right from your employer dashboard. Visit Indeed.com/credit and get $75 towards your first sponsored job. Terms and conditions apply.
With Amdro, you can enjoy your backyard like never before. Our round-the-clock pest protection gives you the peace of mind to enjoy your great outdoors without a care in the world.
Cannonball!
Okay, we can't defend you against the splash zone. But when it comes to ants and other pests, we've got you covered 24/7. Find Amdro in the insecticide aisle at your nearest retailer.
With the Capital One Saver Card, you earn unlimited 4% cash back on dining out or in, 4% back on entertainment or on popular streaming. And now, 3% back at grocery stores so you can make the cake that makes her day.
Happy birthday to you.
So earn unlimited cash back for going out or staying in with the Capital One Saver Card. Capital One, what's in your wallet?
Terms apply. See CapitalOne.com for details.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Shakuri-Rad, urologist, master surgeon, Mon Health Urology. Joining us, September is Prostate Cancer Awareness Month. Doctor, how often should men get a prostate cancer screening?
So it is recommended that all men ages 55 to 69 should have at least annual screening using physical exam, a rectal exam, as well as a PSA blood test. If there's a family history of prostate cancer, then checking a PSA at a younger age may be beneficial. There's also some data to suggest that one PSA check between ages 40 and 50 may predict risk of prostate cancer later on in life. And so those things can certainly be discussed with patients, and each patient is unique and needs to be counseled a little differently.
What is BPH, and how does that relate to prostate cancer?
Sure. So BPH is benign prostatic hyperplasia. It's a benign process where prostate cancer is a malignant process. BPH relates to blockage of the urinary system, which may result in reduced ability to empty the bladder. So symptoms can be things like a slow stream, urinary urgency, frequency, nighttime awakenings, having to strain to void, to name a few. These symptoms can occur when the prostate enlarges, which we call BPH or benign growth, but it can also occur sometimes when there's cancerous growth, and that cancerous growth causes blockage. And because of that, it's important for all men to get checked by an experienced urologist if they are having those symptoms and don't just put it off.
So what is UroLift, and how does it work?
Sure. UroLift is the least invasive treatment option for BPH, and it involves placing sutures in the prostate that cinch the tissue that is causing the blockage to the side, so we don't cut or burn or destroy tissue in any way. And by doing so, we open the path for the bladder to empty more freely. It's also the only treatment that has been shown not to have any sexual side effects such as erectile dysfunction or urinary side effects such as urinary incontinence. Here at Mon Health, we have a center of excellence for UroLift, and I was about 3 years ago, I was the first person that brought this treatment to the region, and our patients have done absolutely marvelous.
Are there other treatments available that just improve overall quality of life?
Absolutely. So we offer, a lot of my patients joke and say that I'm a quality of life surgeon. And so, any treatment I offer, I try to do so with the patient's quality of life in mind. Because if I extend a patient's quantity of life without improving quality or maintaining quality, then I haven't done them really any favors. And so we have treatments such as the Interstim, sacral neurostimulator, for patients who suffer from either urinary incontinence or fecal incontinence. With this treatment, and this treatment is very, very effective. Robotic surgery, we touched on earlier, has really advanced the way we treat prostate cancer, kidney cancer, and other reconstructive surgical treatments for the kidneys and bladder. And at Mon Health, I now offer same-day outpatient robotic surgery for prostate cancer for select patients. This allows us to really get the patients home and allow them to recover in the comfort of their home. And also in the current healthcare crisis, it helps with our bed shortages and staffing shortages.
You know, we've talked before about the robotic surgery, and we've discussed this on the program, how far it has come and how much of a difference it makes, and you touched on it there, in, you know, minimizing the patient stay in the hospital, getting folks home, and really getting the recovery process started as soon as possible because of the precision you can work with when you are performing these robotic surgeries.
Absolutely, and I think it's important for patients to realize that when we talk robotics, this is not an automated process. There's a experienced surgeon sitting behind a controller, and it's important to really appreciate that. Not all surgeons have been trained robotically, but more and more are being trained that way. And these advanced tools will allow us to treat patients better. And my goal is always to minimize even minimally invasive surgery further. So we keep pushing the boundaries, and at Mon Health we've had great success and have established a center of excellence for robotic surgery.
Got to squeeze in one more break. We'll continue our conversation with Dr. Shakuri-Rad in a moment on the Voice of Morgantown, WAJR.
It wasn't that long ago I wasn't able to sleep in my own bed. Technically, I still had a bed, but because of my wife's struggles with CPAP, I was the one having trouble sleeping. The noisy machine, her constant tossing and turning. I had to move out to the couch, out to the recliner, out to my son's bunk bed. That is, until she started using Inspire, a sleep apnea treatment that works inside her body with just the click of a remote. Now I'm back in bed with my wife and our 100-pound lab. Good boy.
Get back to sleeping in your own bed with Inspire, a sleep apnea treatment that works inside your body with just the click of a remote. That's right, a button. As you sleep, Inspire keeps you breathing normally and sleeping peacefully. No mask, no hose, just sleep. To learn more, visit InspireSleep.com. That's InspireSleep.com. Inspire. Sleep apnea innovation. Inspire is not for everyone. Talk to your doctor to see if it's right for you and review important safety information at InspireSleep.com.
Kevin Harlan here from Monday Night Football on Westwood One. Join me and Tony Baselli from Lambeau Field in Green Bay. It's Aaron Rodgers and the Packers playing host to Jared Goff and the Detroit Lions. Both teams are looking to bounce back from losses in Week 1 and pick up their first division win of the year. Don't miss any of the action on Monday Night Football.
Coverage at 7:30 following the Sportsline Monday here on WAJR. Friday night, University against Fairmont Senior.
To throw. Deep down the middle. A man is there. It's Jackson. It's caught. And it is a touchdown for University. Elijah Jackson reels it in.
Coverage at 7:06. Then game night until midnight. We'll scream Morgantown at Woodrow Wilson.
There's the reverse, and Lawrence has some room to run. Running away from defenders down the far side. Keeps his feet inside the 10, the 5. Dives for the pylon. Touchdown, Mohegan.
Morgantown at Woodrow Wilson. Clay Battelle at Tigers Valley. Streamed at WAJR.com.
New surveys show that Americans don't think vaccines are enough to protect themselves and others from COVID-19. 80% want thermometers used in public places to screen for COVID-19. 36% know that non-contact devices are inaccurate, and 60% would not recommend that friends or family members enter places that screen with them. To be safe, use Exergen at home, at work, and in public. It's the only thermometer proven accurate by more than 100 published clinical studies. Learn more at Exergen.com.
So sticky.
At Hannah's Organic Honey, business may be sweet, but they need an e-commerce queen bee to lead the hive.
Okay, these jars are going to Jakarta. Oh, wait a minute. Does that say Jackson?
Indeed can help them hire great people fast.
I need Indeed.
Indeed you do. Schedule virtual interviews and talk to candidates right from your employer dashboard. Visit Indeed.com/credit and get $75 towards your first sponsored job. Terms and conditions apply.
We're planning a trip to Spain later this year.
But our Spanish is...
It's pretty bad. So we're using Babbel.
Babbel's conversation-based method teaches you real-life words and phrases. And with Babbel's interactive, bite-sized lessons, you'll remember what you learned.
There's no easier way to learn another language.
Ahora hablamos español.
He just said now he speaks Spanish.
Babbel, language for life. Now try Babbel for free. Just go to Babbel.com. That's BABBEL.com.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Speaking with Dr. Shakuri-Rad this morning, Prostate Cancer Awareness Month, all month long. And how can people reach you if they would like to make an appointment?
Good question. And so, like most other things, we have online presence, and so monhealth.com/urology is a great place to start, where patients can find out about our services. They can also make appointments or request appointments right there on the website. Patients who would like to speak to someone on the phone can call our phone number 304-599-3074 and schedule an appointment for a consultation. I also have a website called RAD, my last name RAD, R-A-D, roboticsurgery.com, where patients can learn about urological diseases and get a lot of good information, which I try to keep updated. All of these resources will hopefully help patients make their decision on where they want to seek care.
What would you say to the man who is either stubborn and does not want to come see you, or any doctor for that matter, or is just hesitant and has maybe misconceptions, or has heard his friends tell about how terrible the doctor was, if you catch my drift? What would you say to the hesitant patient, I guess?
I think it's important to just get the information. I think there is a lot of hesitancy, and not just in healthcare, but many other topics that we face. And just getting the information, I think, is a good starting point. And also talking to other men. We are not alone. Our neighbors, our friends that we go and golf with, our friends and community members in the churches that we go to, they all have been through similar things in life. And so just simply talking to someone else may ease some of the concern, and it really may open up doors to come see someone who can help you early. And that's the key. Early intervention will prevent a lot of the difficulties that you would otherwise face if you were to ignore your problem.
Well, it's one of those things, it's not nearly as bad as folks make it out to be. And like you said, to begin this show, early detection, when we're talking about prostate cancer, early detection is always the key.
Absolutely. And like I said, a simple blood test, a physical exam that will give us, maybe it raises a red flag. Now, some patients, may be under the impression that, hey, if my PSA is elevated, I'm going to have to be poked with a needle and get a biopsy. And that's not the case. We have some advanced technologies. We do MRIs on patients with suspicious PSAs. We may watch them for some time. We may repeat some testing. There's some genetic testing that we now are using as well. And so all of these things put together allow us to counsel patients. And if a biopsy is needed, we also have improved on that aspect of things and provide minimally invasive biopsy techniques where patients are very comfortable. There is minimal discomfort. And so all of these things combined will hopefully provide patients with a better experience, and most importantly, allow us to catch this disease, this really deadly disease, early.
Before we let you go, one last question. What's the best part of your job?
I love being part of the community, and it's a real honor and privilege to be able to provide care to our patients, to our community, neighbors, friends, and I look forward to being here many more years.
Dr. Shakuri-Rad, our guest this morning. You can find out more about him, monhealth.com/urology. If you want to learn more information, reach out to make an appointment. Dr. Rad, thank you very much for the time. Have a great week.
Always a pleasure. Thank you. You too.
Coming up, we will have the top of the hour. That means a check of national headlines with Fox News, local news, and we'll get your AccuWeather forecast. And afterward, at 9:06, it's time for Talk of the Town, only on the voice of Morgantown, WAJR.
This is 104.5 FM and 1440 AM WAJR Morgantown. Station.